based in the UK. I also do some lecturing at various universities across the world, and I'm also an educator. I have my own education platform called iTools. It's full of what I believe to be very useful information if you are a practicing eye care specialist. Some of it's free, some of it's paid for, but go and take a look at the website, and you can see what there is there. And I think there's a lot for you to have a look at, and a lot for you to use in your own professional development. But today I'm talking about glare, and I'm talking about how we can help people as eye care specialists, how we can help people overcome or manage problems with glare. So the title of my presentation, and here's the sort of webinar plan, is glare and contrast management using filters. What I'll be covering is there's 5 points here. I'll be covering different types of glare. I'll be showing you some examples of glare. I'll be talking about the effect of one form of glare, disability glare, on contrast and how it reduces contrast. And then I'll be talking about ways that we can help people manage glare, polarized lenses, anti-reflection coatings, and photochromics, and not only how we can help people manage glare, but how we can help them ensure long-term eye health. And then I'll also be focusing just towards the end of the presentation on esports and gaming, and how we can help with glare reduction filters there, and then also how we can help people who have photophobia overcome or reduce their issues with that. It's important because glare affects visual ability, and if you have reduced visual ability, then that can affect your quality of life. It can affect your ability to do your job. It can affect you in your leisure time. It's important because we can, through very simple, fairly low-cost techniques, systems, products, we can help people reduce glare. And of course, by helping people reduce glare, then we can also enhance the prosperity of the practice to make sure that the practice is sustained well into the future. What to do? Well, we need to first of all find out if the people we're seeing are patients or customers. We need to find out whether they're having problems with glare, and the best way to find out is to ask them, and maybe give specific examples. Does the light bother you when you're outside, when you're gardening, when you're taking part in sports outside? What about things when you're driving at night time? So we can find out what's causing them some glare issues, and then we can make recommendations to help them reduce and manage that glare. So here we have a couple of types of, well, 3 types of glare. So discomfort glare. So I'll be talking more about this towards the end of the presentation. So discomfort glare is where people are very uncomfortable in the light situation they are in that particular environment. It causes an uncomfortable, sometimes painful sensation, especially when the light source is directed into the face of the person. I'll talk a little bit about that towards the end of the presentation. What I'll be focusing on mainly is disability glare and the effect of disability glare on reducing contrast, where things can no longer be distinguished as separate entities. So this is where something that's very dark on something on a pale background, to us, to the person suffering glare, it's not dark on a pale background. It's grey on a slightly less grey background. So that contrast in brightness between two different images is lost, and that's why we lose. Glare causes contrast loss. And then again, I'll be talking a little bit about glare on task. So this is when, if you were sat outside in the garden on a bright sunny day, trying to use your phone or a laptop, and it was sunny, and the sun was shining on your screen, you wouldn't be able to see the screen very well. You wouldn't be able to make out what was on the screen, and that's called glare on the task. When there's a direct line of light onto your screen, which causes you vision problems. And it's, as I said, I just want to emphasize this point, it's the disability glare that causes a reduction in contrast, causes a reduction in visual performance. So here we have some examples of glare. So this is nighttime glare. You know, I hear this a lot from patients when I'm examining them as you know, in my eye practice, in my eye care work, that they're struggling with the car headlights. And, you know, car headlights are bright. They need to be bright because of, you know, safety reasons. And they don't obviously look like this. Their car headlights are a point source, and it's, you know, possibly some dirt on the windscreen, or dirty spectacle lenses, or spectacle lenses without an anti-glare coating on, or maybe some corneal changes, but particularly some crystalline lens changes, which causes the light to appear. A point source causes those things I've mentioned, causes a point source looks like this sort of like glare source. We get this starburst pattern, as it's often called, and that's the, you know, the optics of the sort of dirt on the windscreen, and the optics of the eye and age-related changes in the eye that cause this type of effect. And, you know, for those of you that work in practice, you'll know that this is a very common problem that patients will complain about. Another type of glare is glare that we get off the surface of water. So the ocean, a lake, a river, and, you know, and if we're working on the water, if we're fishing the water, if we need to be sailing on the water, or if we're working on or near or in the water, then this type of glare from the sun off the surface of the body of water, again, can be very negative, have a very negative effect on visual function. And even in the office, there are problems with glare. So here we have some office lights in the ceiling. Sometimes they're in the walls. And the diagram below shows light or glare coming from the windows here in this office from direct sunlight. We can get glare from the lights in the ceiling or in the walls, and then we can get reflective glare off the surface of the electronic device we're looking at, whether it's a tablet, a computer, or a laptop, or a phone. We can get glare off there. And another place we can get glare, which this doesn't show, is if this person was wearing glasses without an anti-reflection coating on the rear surface, then the light coming down and bouncing off the rear surface of the lens into the eye would also be another source of reflective glare. And the reason we get this glare, the reason we get this contrast reduction, is because usually it's age-related changes in the crystalline lens which cause the light from the point source, in this case a car headlight, to be scattered. And it's the scattering of the light within the eye that causes the glare, that causes the point source to look glary. And it's this scattering across the image, across the retinal image, which causes the contrast to be reduced. So I think what this image is showing is, I think there's a pedestrian somewhere towards that side of that image, and the car headlight shining light into the eye causes the veiling luminance across the retinal image, reduces contrast and makes it much more difficult to see the pedestrian in this glare situation. So it's this scattering of light within the eye across the retinal image that causes the reduction in contrast. And the shorter the wavelength of light, so blue light, violet, indigo light, towards the short wavelength end of the spectrum is what's scattered the most. The shorter the wavelength, the more it's scattered by crystalline lens age-related changes. This is in normal light. This is the visible spectrum. But of course, there's lots of blue light that comes from, excuse me, car headlights, the LED car headlights. There's lots of blue light, short wavelength light that comes off phones, that comes off laptops, that comes off computers, that comes off tablets, and that comes off smart TVs. There's a lot of blue light that comes off those devices. It's the manufacturer's attempt to give good contrast, but what actually happens is that blue light is scattered and it reduces the contrast. It's scattered in the eye and it reduces the contrast. So short wavelength light is it's an issue in terms of glare and contrast reduction. And here's an example of contrast reduction. So someone very kindly has gone to the trouble of painting the edge of the step yellow so a person can see easily where the edge of the step is. Just imagine if there was no yellow, it would be grey on grey on grey on grey, and it would be difficult to see where the step ends or starts, which is great. But then when there's a glare source, that effect is mostly lost. I mean, we can still probably just about work it out. It's far better to have the yellow painting than nothing at all. But we can see that the edge of the step is far more difficult to see in this situation of reduced contrast because of a glare source. Maybe the sun is shining up this stairwell towards the person, causing that reduction in contrast. And of course, that can be there's a safety issue there, and it might take someone a bit longer to navigate those stairs, hopefully without falling because of the glare situation. So how can we help people with these types of issues? Well, as eye care practitioners, we'll know about anti-reflection coatings, sometimes called anti-glare coatings, and they are very useful in terms of nighttime driving. I always say to patients, look, the car headlights will be there. I can't make them go away. I don't want to make the car headlights go away because they're there for safety reasons. So you can see the car, but I can make it less glary. I can make it less starbursty. Won't be perfect, but it'll be better to have an anti-reflection coating both surfaces of the lens to stop car headlights from behind you bouncing off the lens into your eye. And this is a very easy way to manage glare, anti-reflection coatings for nighttime driving. And then for people who are out and about in during obviously sunlight hours, perhaps recreational sport, or their work means they need to be outside, then I recommend polarized lenses, particularly when people are working on or near water. This is a lovely image here of this lens, this polarized lens. You can see here outside of the lens, it's all washed out. The contrast is gone. It's very glary, very bright. And then within the lens, got much better contrast and much less glary and much more comfortable. And this is the effect that polarized lenses can have. We can put them into regular sunglasses, plano or with prescription. They don't look different from regular sunglasses, but they work better than regular sunglasses. Regular sunglasses are just tinted lenses, and that's beneficial in glare reduction. But I think certainly for anyone working near water or on water, polarized lenses, or where there's reflections off surfaces like these roads, we can see with the polarized lens on the road, there's just much more definition of where the edge of the road is, much more contrast. So yeah, regular sunglasses have their place, but I think to really help people, we need polarized sunglasses with or without a prescription as necessary. And then we've got this fairly recent range of photochromics. These are photochromics that work inside the house and inside cars, in buildings. Previous generations of photochromic lenses worked on ultraviolet light, and of course inside a house, there isn't much ultraviolet light. The windows screen it out. Inside the car, the windscreen screens out the ultraviolet. So earlier generations of photochromics didn't work very well, if at all, inside a car or inside a house. But these latest versions, this photochromic, the chemical reaction takes place when sun hits the lens, impacts the lens, not just UV, but sun, any sunlight. So these work inside the house, these work inside buildings, these work inside the car. So again, for people who are troubled with glare in those environments, this type of the latest generation of photochromics would be worth discussing with the patient. And of course, the other side to this is the healthcare side. Excuse me. The healthcare side, the long-term healthcare side, because polarized lenses and photochromics, they absorb blue light and they absorb UV light. And UV light is, so these lenses are good at reducing glare issues, but UV light has also been associated with cataract formation and cataract progression. So wearing photochromics cuts down on UV, and that will then help with a reduction in cataract progression. And blue light has been associated with the development of age-related macular degeneration. So again, anything that keeps out, we don't need blue light. When we're outside, we don't really need blue light to see well. So we can cut out the blue light using these sorts of lenses, and that again can help in terms of the development, reduce the development and reduce the progression of macular degeneration, which I think is important. So I think I've just mentioned this. Of course, UV, not only with cataract, but also pingeculae and pterygium, and of course, a nice pair of sunglasses with a big lens, fitted neatly, maybe even with some side shields perhaps, can keep out that sunlight and prevent the formation of pingeculae and pterygium. And I should have also included here basal cell carcinoma usually on the lower lid margin, which again has been associated with sunlight exposure. And I've already mentioned that blue light exposure is associated with age-related macular degeneration. Yeah, I also, when people are outside, this is what I do myself. I wear my sunglasses and that helps, but I also wear a peaked hat to keep the sun, if I'm in a sunny environment, to keep the light from going down behind the lens and then into my eye. I like to wear a peaked cap. And this enhances contrast, reduces scatter inside my eye, and that helps with visual acuity, visual comfort, and just helps me get around, and I'm less dazzled and it's less glary. And it stops my forehead from catching the sun as well, which will help with the prevention of any skin issues with sunlight exposure. Anti-reflection coatings, again, not just about cars and nighttime driving, but I've mentioned in the office, there are lots of devices, lights, sunlight, blue light from devices, all coming towards the eye. So with an anti-reflection coating, it makes the lenses look nicer anyway. So with an anti-reflection coating, we can help cut down on that glare. And I know that some people are also recommending blue light filters, maybe a controversial area. But if we think about it, we know that from very good research that exposure to blue light from sunlight is related to the occurrence of age-related macular degeneration. So there's a lot of blue light coming from these screens. I know, well, no, there isn't a lot of blue light coming from these screens. But if you can imagine a child gets their first device at the age of 10, and they're probably still looking at devices when they're 80. So that's, 70 years of exposure to blue light from a phone, from the laptop, from the TV, from a tablet. So it's an accumulative effect. So whereas some people say there's no evidence for blue filters in regular glasses, My view is different. I think that the long-term exposure to blue light from these devices has a strong potential for causing a massive increase in the incidence of age-related macular degeneration in the future, and we would be well advised to recommend blue light filters to our office working patients. On that note, let's talk about esports and gaming. So these are when people spend a great deal of time, many hours every day, looking at screens. And again, there's lots of blue light there. And, there's a great deal of fun to be had, but there's also a lot of money to be won in competitions and being signed up by teams. And so there's fun and there's a financial reward for esports and for gaming. But there's also a lot of blue light coming from there. So not only will the blue light cause some glare and cause some vision problems and contrast reduction, which is something you really don't want when you're a high-level esports person. But there's also a potential for long-term eye damage, over a period of 50, 60, 70 years of blue light exposure. So what we can recommend for people who are in that environment is, again, these esports blue light filtering lenses. They're yellow because yellow lenses filter out the blue light, and it's the blue light that causes the scatter. And of course, these can come with a prescription as well if people need that for their intermediate computer distance. And then just to finish off with, again, filters for people. So this is back to the discomfort glare, and it may even go beyond discomfort. People with this type of glare, this type of photophobia, I'll call it, severe pain and discomfort in the presence of light. And this can be due to cataracts, very dense cataracts that have yet to be operated on, or dense cataracts that can't be operated on for health reasons or other eye reasons. People with retinitis pigmentosa have a lot of photophobia, people with albinism, and also it occurs frequently in people with age-related macular degeneration. So this is discomfort glare plus. And what we can do is recommend, there's a whole range of different, again, mainly blue absorbing filters. The last one, this brown one at the bottom, it's difficult to see what it says, but it says 585 nanometers. So that's where it absorbs up to. So it lets light through that's greater wavelengths than 500 for retinitis pigmentosa. So again, we've got advice on maybe using a 511 nanometer filter for cataract and so on. But people with these conditions, in my experience, often struggle a great deal when there's too much light around for them. So I think I'm just going to wind up there now. So just to remind you, I've been talking about glare, how it reduces contrast, and what we can do to help people overcome those issues. I've mentioned types of glare, shown you examples. I've spoken about the relationship between glare and contrast reduction. And I've spoken about how we can help people with polarized lenses, with anti-reflection coatings, with photochromics, and with specialist tints if there is photophobia. And I think this is an important topic because glare can have a negative impact on quality of life. It's an important topic because we can, through helping people with this type of management, we can ensure we have prosperous practice. And what we need to do in practice is ask people, sometimes they might not volunteer that they're struggling with glare. We need to ask them specifically, do you go out a lot? How are things in the garden? Do you run? Are you a keen cyclist? Those sorts of things. How are things in the office? What about nighttime driving? We can go over those sorts of things. And then when a person volunteers that they're having some problems with some glare, then we can recommend the appropriate management. I'm going to stop there. Been very nice talking to you about this important topic, I think. Thanks very much. All the best. Bye for now.